Of course, I wanted to bring up your newest elemental diet study. And it looked like this one focused mostly on methane and intestinal methanogen overgrowth. I got that right. And it looked like it was just another very successful study. So any comments you want to make about this one?
Yeah, so I mean, just to go back, this was the elemental diet this was the palatable elemental diet clinical trial that we did on 30 subjects. Just to give you a little bit of a study design, is that patients underwent 7 days of screening. During that 7 days of screening, patients filled out daily diaries, took pictures of their poop throughout the whole study, and also gave us samples. Now, we took blood, we took saliva, we took urine, we took like breath VOCs, and also stool. Now we are analyzing all these as we go along. There was like so we took a lot of biologic samples, and then patients were treated with 2 weeks of elemental diet and exclusive. They couldn't drink any other drinks or eat anything else. A little bit of a black coffee and a little bit of a black tea were allowed, and drinking water is okay.
And this was Mbiota, right?
Yes, this was Mbiota. And then after the Mbiota was finished after 2 weeks, then we followed the patients for another 2 weeks to see what happens to them after reintroduction of food. Because we wanted to see how whether symptoms that improve, and then when we introduce food, whether symptoms starts to worsen. Which, interesting enough, some of the symptoms continue to get better. In retrospect, if we knew that, we would have continued the follow-up way longer. Because the common follow-up after an intervention in IBS world is about 2 weeks. So that's what we did. In this scenario, we should have done longer, but on the next study, we're going to do longer. Now, at each of these time points, patients provided stool. And we looked at this stool before the Mbiota, after Mbiota, and then 2 weeks after. On top of it, every day, patients, when they woke up, they blew into these tiny tubes, and we measured the methane levels in that breath. So number one, that we saw that during the elemental diet treatment, within 5 days, actually, the methane levels drastically dropped, which is actually faster than antibiotics. Which number one, it tells you how powerful diet can be. And number two is that, yes, we can develop things other than antibiotics to treat this. That's very sort of, that's the ultimate goal, right? So at the end, to stay away from empiric antibiotic for patients. But also we followed patients to see what happens to the methane all throughout. So what we did is that we correlated the amount of methanogens present in the stool with the methane in these breath tests, and they correlated, right? So because one thing that we weren't sure is that, okay, we're decreasing the methane production drastically by elemental diet. Is it because, well, they didn't have substrate to produce methane, so they're like, okay, I'm going to sleep until next time that I see food? And that turned out not to be the case, because we looked at the methanogens, and they're in fact actually decreasing. The load is decreasing, because even if they're sleeping, they're in dormancy, we still pick them up, right, based on genetic markers of these organisms. No, and in fact, actually, we saw that actually they're going back to the original state. Now, how does this happen? Two scenarios. The one scenario is that, well, we're just essentially decreasing it. They're just dying because of the elemental diet has some components that helps you in terms of almost suppressing of the growth. For example, MCT oils are known to decrease the growth of some of the bacteria and archaea. So maybe that's it. But I think it's the other way around. It's actually it's promoting the healthy growth of gut microbiome, and that healthy growth of microbiome and goes back and tells the archaea, hey, you have no room to be here. You should get out, right? And essentially that's factory setting gut microbiome now getting rid of the weed itself. So that's how it is. The reason why I say that, because the other changes that we saw in the stool microbiome is very similar to post-hibernation animals. Believe it or not, there are some researchers working on animals who hibernate and their microbiome, right? So they go collect stool from that hungry bear that just woke up after 6 months. This study was done in Sweden or Norway. And they looked at the gut microbiome of that animal, and it actually was, not surprisingly, very healthy gut microbiome, right? But the changes that we saw after Embiota was actually kind of similar to changes that we saw in those animals post hibernation, which is essentially complete reset of the gut, right? Because they're not eating, right? Because one thing that is very important for the gut microbiome, every day in our gut, the lining and epithelium sloughs, right, on a constant basis, right? Almost half a pound of your gut lumen sloughs and falls into your gut, right? So even if you're not eating at all, there is some food that goes through in the form of your own flesh going through, right? The beauty of that is that our normal native gut microbiome survives on that, thrives on that, but the invasive bacteria, the overgrown bacteria and archaea, can't survive on that. They need food, right? So when that phenomenon happens, whether through intermittent fasting, whether through hibernation, whether through elemental diet, native bacteria can survive, the invasive bacteria dies. And that native bacteria that grows back in even further pushes out the overgrown bacteria because that's their preferable environment now, right? So that's the beauty of it. Now, if you continue overeating, like that bear that is supposed to do, because now they eat everything in their path, right? Pre-hibernation gut microbiome is not necessarily that healthy. And in fact, that they have put the poop of a pre-hibernation bear into mice, and mice get fat and unhealthy. And post-hibernation poop, they put it in mice and they get fit. Well, bears have to do that. So this cycle happens, and I think that's what we're triggering. And this is where I think like elemental diet now and biota in this scenario and intermittent fasting and hibernation all of a sudden are linking up for the gut microbiome health.
You know, that is so fascinating. I think most of us had thought the mechanism with elemental diet was that it just starved the overgrown microbes to death.
Yes.
But this is a whole different viewpoint. I'm loving it.
Yes. So no, so we were expecting complete, like, you know, complete suppression of bacteria and archaea post-elemental diet. That was not the case at all. In fact, actually, the breath testing didn't completely become flat. It switched from, for example, methane dropped, obviously, all throughout the test. But the peak of the hydrogen in SIBO patients didn't completely go away. It's actually shifted towards the colon, which is the normal, right? So if it was about only starvation and wiping them out, no, that was not the case. You wouldn't have seen the colonic peak. We did see the colonic peak. So it's essentially switching a small intestinal overgrown bacterial picture to a normal colonic fermenting bacteria where they're supposed to be pictured. So it's kind of resets the gut rather than wiping it out. Yeah, I know. All throughout the years, in the last 20 years, we thought we were wiping them out. That was not the case, which is very fascinating. And we're seeing it in the stool as well, not just the breath test.
Yeah, and better than we could have hoped for. This is excellent.
Yes,
It's like,
yes.
so now we know a method that can truly help dysbiosis, even whether, whether it's SIBO, EMO, ESO, or something else even.
Absolutely. So this is the thing, right? So the SIBO and EMO are just two subcategories, right? So the whole dysbiosis, if you think about it, yes, can be like have an intervention that can sort of reset the gut. So that's potentially that can happen, right? For example, in the past we didn't know intermittent fasting, but I mean, how long can you do intermittent fasting forever? You can't do that, right? But and also intermittent fasting, because the cycles of sloughing of the gut is about 5 days, right? The lining of the gut it takes 5 days, and it doesn't happen at each segment all the time, right? So you need 1.5 cycles, about 8 days. That's the magic number to reset the gut, at least. And so that's what we saw. For example, that's probably where you get a reset of your gut.
But you can't do it for just 8 days.
Well, yeah. Well, I mean, technically you can. So that's the minimum that you should do to get that reset for sure. But the thing is that for intermittent fasting, well, you can't fast for 8 days, right? So
Right.
this is kind of
Right. No, I'm just talking about the M-Biota.
yeah.
Yeah.
So for Imbiota, 8 days potentially is the magic number. So we are planning hopefully to do another study in healthy individuals uh, to test that timeline to see, okay, when is the point that you see that beautiful gut reset, sort of, and 8 days based on the preliminary data is probably the time, but we'll check it.
And also you saw a reduction of visceral fat too.
Absolutely. So that's actually that's one of the things that we looked at when we looked at, okay, how many days is enough? Because we checked in some of the subjects almost every day, we checked the visceral fat, right? It was tedious, but we did it. But looked like the visceral fat, because, in total, at the end, about 11% visceral fat loss was seen. Almost 10% of 10% loss happened within the first 8 days, right? And then the other 6 days was just 1%. So that shows that goes like this. It's not like continuous like that. It was almost exponential. So that was one of the time points that popped up, that the 8 days might be the magic number.
It's interesting because, the original study that Mark and team did on elemental diet, some folks didn't clear the SIBO at 14 days, and then they went on to 21 days. And we do see this clinically. Some people do
Right.
need longer. How does that fit into this? Because I wouldn't want people to automatically think, oh, I only need 8 days and that's
Right.
it. We do see.
That's what I'm sitting here thinking.
Yes.
Yeah.
So and I was contemplating about that, and I think the answer is how much elemental diets have come along. If you think about it, Vivonex Plus, the formulation goes back to late 80s. So it was just Vivonex in 70s and all the way to mid 80s, and then Vivonex Plus came in, and it hasn't been updated yet, right?
Yeah.
And that study was done with Vivonex Plus. So if you look at, for example, Vivonex Plus, it has LCT oil. It has, so it's things that modern elemental diets don't necessarily need to have it. The technology on purifying amino acids have drastically changed. So that's another sort of important thing. The purifying MCT oils have drastically changed. So now we use MCT oils in elemental diet. So Vivonex is not necessarily the same as Imbiota. So maybe that's why we had to go longer with a Vivonex as opposed to the modern elemental diets such as Imbiota that seems to do the trick faster than that. I mean, there was actually a recent study again with Vivonex. It's not just Mark's study that was done by the Chicago group, and this was done in eosinophilic gastrointestinal disorders. These are EGIT patients, and they had to do 6 weeks of it. to see response. 6 weeks exclusive elemental diet. I mean, that's challenging. But I think 15 patients were able to finish it. So yeah, so that's the thing. So the modern elemental diets, like Biota, are another beast, clearly. As you compare it to the first generation of elemental diets, right? The Y1X versus Y1X plus. Y1X plus was like a huge revolution, but it hasn't changed in the last 2.5 decades. Yeah, more 3 decades. Yeah.
And in Ambiota, the MCT oil is just built into the formula, right?
Yes.
You don't have to add it. So that's really nice.
Yes.
That's really nice. Yeah.